Hey folks, I'm Dr. Patty Barch, the owner and founder of Naturally Unbridled Wellness, a holistic therapy center in Onalaska, Wisconsin. Today I wanted to share a case with you. So this case is about my dad. And my dad was having some low back and sciatic pain for a while, and it was causing some problems. He was having trouble sleeping, and he was in so much pain really that he was going to bed pretty early and not having a lot of quality of life. So we did some things early on that were helpful in, he was doing the pulsed electromagnetic field therapy, and I sent him a pillow, a especially curved pillow that goes between the legs. So if you're a side sleeper, it helps to keep your legs in a neutral position so it's not putting a lot of torque on your low back. And so that also helped. But he really hit a plateau and wasn't making a lot of progress. So he wanted to go have some medical testing done to see if there was anything bigger going on, fractures or tumors or anything like that. So he went and had some testing done, and they ended up sending him to a sports medicine doctor. And my parents really liked the sports medicine doctor. Clearly, he was very charismatic, and they were pretty gung-ho to start the protocol that he recommended. And the recommended protocol was a drug called meloxicam, and then also a course of steroids over a period of time with some physical therapy. And I was a big proponent of the physical therapy. I'm like, yep, that's a great idea. Absolutely do that. But I was like, slow your roll. Let's just take a look at these drugs and see what the potential side effects are, and then have a discussion about whether we want to start with those or consider other options. And my parents live in Tennessee and I live in Minnesota. My office is in Wisconsin. So we're always doing things over a distance. So I went online and I looked up the side effects of meloxicam. May cause an increased risk of serious cardiovascular thrombotic events, blood clots, myocardial infarction, heart attack, and stroke, which may be fatal. This risk may increase with duration of use. Patients with cardiovascular disease or risk factors of cardiovascular disease may be at greater risk. Well, my 78-year-old dad has blood pressure issues, and both of his parents had heart attacks, so I was not a big fan of having my father try this meloxicam. So, and then I know through a lifetime of experience that steroids do a couple of things. One, they do suppress inflammation, and they do that by inhibiting your immune system, which I don't think that during a pandemic is the best time to suppress the immune system of a 78-year-old man. Also, it's not uncommon, in fact, it's very common for when the course of steroids is over with, for there to be a rebound effect. And that means the problem is worse after the therapy than it was before starting the course of steroids. Happens all the time. So what I could see the trajectory of the medical model being, put him on a high-risk anti-inflammatory drug, meloxicam, that puts him at high risk for a cardiovascular event. Put him on a course of steroids that will, and those with the physical therapy, which I'm a big proponent of, but those things, the anti-inflammatory and the steroids, would suppress his inflammation and his symptoms for a period of time, and then they would come back worse than they were before. And then what would the next step be? Surgery. And that's just the path that it was gonna go. So I was like, okay, let's talk about options. I'm not the boss of you, and you're, fully empowered to do those medications if you want to, but let's look at natural options that we could try first. And if those things work, you won't need to go down that road. And so the testing that they did show that he had some degenerative discs and some arthritis in his spine, and these were probably causing the problem. So I put together a protocol for him. The first thing was not to drink any less than 64 ounces of water. I would prefer he's closer to 80 ounces of water, but when you're starting with maybe 10 or 12 ounces of water, to get to 64 is really amazing. So one of the reasons why the hydration part was so important is because those cartilage discs, those little spongy discs that go between every vertebrae, they are mostly water. They're literally little sponges. And so if you are dehydrated, those things turn in from soft and chewy sponges into beef jerky. So you can imagine that there's no cushion in between those vertebrae if you're dehydrated. So the number one thing we had to do was get him hydrated. Then we use some anti-inflammatory supplements, one called Inflammatone, that has anti-inflammatory herbs in it to help suppress naturally the inflammation process without any increased risk of heart attack, stroke, or thrombotic events. Whole body collagen. So collagen is a protein that helps to build connective tissue, and those cartilage discs are connective tissue, and so I wanted to provide a nutritional source of collagen to help support the rebuilding of those. The HSN complex, believe it or not, hair, skin, and nails, those are types of connective tissue also. So more nutrition, give his body what it needs to build and rebuild connective tissue. We used a CBD roll-on to reduce inflammation locally, and then also a CBD pill for systemic inflammation. We also used ArthroSoothe capsules to help with joint lubrication and joint integrity, and then ArthroSoothe cream topically for the pain and inflammation. We also used a homeopathic remedy called Relief Tone, in addition to continuing to do the PEMF and the physical therapy. So we did all of those things, what I call turbo dosing, for a short period of time, a couple of weeks, and then I moved him down to a maintenance dose. Within days, he had significant improvement of his pain level. And when they went back to the sports medicine doctor this week, he said that his leg pain, the sciatic pain, was gone, and that the low back pain was at a 1 on a scale of 1 to 10, so barely noticeable. And so I'm like, I just leave it at that. Okay, good, problem solved. We'll put you on a maintenance program. We'll keep your body healthy, keep everything lubricated and hydrated, keep the inflammation down naturally, and you should continue to have good quality of life. So the funniest thing is that I tend to like not even bother to tell the medical doctors when there's a holistic thing happening, because they tend to blow it off. And when my mother mentioned to the sports medicine doctor that my daughter is a naturopath, the sports doctor goes, "Oh, let me guess, turmeric," right? They just like blew it off. But here's the thing, the guy's pissed because he thought the only thing to do for this guy was to put him on this high-risk anti-inflammatory, put him on the steroids, and then the physical therapy, and then probably send him into surgery at 78 years old. So when I say all the time, slow your roll, it's because sometimes there's a better mousetrap that has less risks and more benefits. So I just wanted to share that case with you because there's been many cases in my life, my own personal life, with my own family, that we've been able to effectively resolve a health or wellness issue with 100% natural approach. Okay, thanks. Peace out, peeps. Have a healthy day.